I think a lot of people know the obvious ones, somebody who looks intoxicated, but I think that's not often what we see. I think the things that we see more often are more subtle things, whether that's inconsistency in attending treatment, sort of like a flat affect or depression, anxiety, just disengagement in general, losing friends, losing family, financial issues that they weren't previously having, and the guilt and shame, I think, is also a big one that I see really frequently with these people, because that is so much a part of addiction.
Someone who's using opioids will oftentimes nod. That's probably the biggest sign, so they'll kind of almost like they can't stay awake. That's pupils will dilate either really big or pin size. That's a good sign when someone's pupils don't react to changes in light, that they have some level of intoxication. Those would probably be the biggest. I mean, you can have physical markers like track marks that are often visible on people's arms, but they usually hide those fairly well.
There's kind of more, some of the obvious ones of marks on the arms. If there's the symptoms of overdoses, and that's somewhat well known, blue lips, eyes rolled back, unresponsive, things like that. But in terms of just daily things about to identify with your coworkers, symptoms kind of change per person based on kind of what they're using, but I've heard just money problems, some other things.
Well, they have small pupils, like pin dot pupils. They might be itching their nose, nodding off is a big sign.
Signs and symptoms, withdrawal, somebody who is secretive, doesn't want anybody to know, mood changes, somebody obviously who isolates themselves, somebody who doesn't think rationally, who is very impulsive, somebody who's changed completely from the person they were to the person they are now.
There's a lot of the physical signs and symptoms. I know it's probably been mentioned before, the pupils, the excessive itching. I think some of the things that common people don't know about that is that there's a constant lying that goes on. They couldn't even tell the truth. I know when I was using, I couldn't even tell the truth about things that I didn't need to lie about, even to keep my addiction going. There is this feeling of separation constantly from the rest of the world, not being a part of, even if family is giving as much love as they can in ways, the addict themselves, especially a using addict, won't respond, almost as if they can't let in the love or the care. But the lying is a big one. I mean, just constant lying. And I know for me, even after getting clean, the lying continued for a long time. So it had nothing to do with actually just using. So
somebody that's using, definitely they isolate. They isolate a lot. Like someone mentioned earlier, they lie about everything, and you'll even start to question yourself. You'll be like, am I even in this reality right now? Like, what is my truth? Like, us addicts, like, we're very, very good at manipulating. So manipulating is huge. A lot of people will nod off. That is the hugest sign of an opioid crisis. Absolutely. Nodding off, and it'll almost seem as their mouth, part of it becomes numb, and a lot of itching of the nose. And a lot of people will say, like, I'm just tired, I have a migraine, a lot of, touching the head and things of that nature.
I guess the first would be kind of mood swings, withdrawing. I know when I started using, I tended to withdraw from family activities. Another thing that I think was common for me was my friends and social group changed, and I stopped associating with some of my former friends who weren't using and started to associate with a totally different group of students at the time, because I was in high school. But for me, I mean, the other things I know were common are things like problems at school in terms of grades might start changing, those types of things. That didn't occur for me. It was one of the reasons it stayed hidden for so long, is I was an honor student and maintained those grades, even though my addiction actually started full-blown when I was about 16. I still got good grades, I still played sports, I did all of that, but I was outside of those activities associating with an entirely different group of friends, being a little less reliable, not showing up for things, those types of things. So I think if you start seeing changes in behavior, whether it's at school, problems, different friends starting to appear, definitely that's a warning sign. People would call me a garbage head, because if you had any pill, anything in a syringe, anything in a bottle, I would take it. I wouldn't even ask you what it would do. I just knew it would make me not feel like me. And that was really all I cared about. And, it's a tough way to live. It really, you aren't living at that point. And if you're in that position and that's how you feel, I'm living proof that you can get out of it. And there is a better way.
In my experience, like I said before, you just never, somebody could be acting completely normal and trying to live their normal life. And a typical person that is maybe using drugs and alcohol, you might think in your mind they're disheveled and they're a hot mess, like how the millennials say it, they're a hot mess. But some clients, they have their stuff together, but inside they're falling apart. But I think the biggest thing is just abnormal behavior, not being able to make it to work, not being able to take responsibility for their actions. When an addiction becomes out of control, some addicts think that they can keep it under control, but at a point it's going to get out of control, and that is when they start to isolate. They start to not be able to take care of themselves or other people. They start to not care about the things that used to make them the happiest. And I think that is the biggest red flag for somebody, is if they are seeking out for help, or if they are maybe isolating themselves. Either way, you have to be on your A game and trying to keep your ears and eyes open to if somebody might be struggling.
We see delirium, we see an increased risk of falls, which then leads to fractures, confusion. Sometimes those symptoms are perhaps looked at as someone having a urinary tract infection or dehydration or not eating well. So if family members are not present, it really is upon us to really pay attention to our residents and the behaviors that they're exhibiting.
I think in my world, I see it more often because I'm just trained to see it. Before the interview started, we were chatting, and it was something that was brought up that, you work with people who use drugs. And I don't mean use drugs in the sense that they're using illegal drugs. People who are taking pain pills, people who are overusing or misusing cough medicine. I mean, alcohol is legal, but people do that too. You go to church with people who use drugs. So I think that to be able to recognize and identify it, some things are easier. Maybe if somebody's had too much to drink because you can smell it or see it. But something I think to look for is in your loved ones, your kids, your friends, people in your family. Do you feel that the use of whatever substance it is really affecting a life domain? Are they able to maintain friends? Are they able to go to work, be productive? Are they able to maintain relationships, spouse, children, neighbors, go to church? I think a lot of times you'll start to see people who are using or misusing a substance, they really start to pull back from the things that they love. They withdraw. It doesn't always happen that way, and I understand it, but that's a more obvious thing that I think people can look for. Having a teenager, it's probably really difficult to see because kids have mood swings, hormones and things like that. So I think a lot of times you have a teenager that hides in their room. I have teenagers, they hide in their room. But what's normal for your kid is different from everybody else's kid. I think you as a parent, if you feel something isn't right, something's probably not right. And it's okay to be their mom and dad. You don't have to be their friend. So I think looking for those things that shift from the norm, withdrawing, acting different, becoming angry, sleeping too much, different from the normal.
You got to look out for sudden changes in habits. If you have somebody that's always at home all the time and they start disappearing, weight loss, nodding off, pinpoint eyes, silverware, spoons missing, pop cans with the bottoms off, needle caps, needles, little plastic empty baggies, slurred speech, missing money, multiple cell phones that they normally didn't have, changing of codes on cell phones.
A lot of times I think when somebody may be addicted to an opiate, they tend to start becoming kind of like a loner. If you know, they might have at one point been like a happy type of person, you know, personable and everything like that. Once they get addicted to drugs, they fall back from that. They be, you know, more quiet, more restrained. Their appearance starts diminishing. They just don't care as much about that sort of thing. You know, whether it's instead of wearing short sleeves in the summer, they still might wear long sleeves because they're trying to hide bruising and track marks on their arms from needle injections. I think just the cleanliness of their environment and overall that it starts to diminish. The bags, the wrinkles, it all starts coming out, and it'll even be very young people that you wouldn't expect to look like that. That's some of the things to kind of watch out for.
It is variable in the type of medication that an individual is experiencing issues with, whether that's SUD, substance use disorder, or opiate use disorder. There are different signs and symptoms with those. But normally in any kind of addiction, what you're going to see is isolation that occurs. And that isolation is one of the first things you're going to see. You got to remember, whenever individuals are struggling with addiction in some form, they're usually doing it to escape from something. All right. Now, physical symptoms, what you would see, opiates are usually one of the easier ones to identify. You're going to see pupil changes with constricted pupils. And then with someone overdoses, you're going to start to see the respiratory drive affected, because that's what it actually does. That's why it's so dangerous, is it'll actually suppress their respiratory drive and the individual will stop breathing.
The signs and symptoms that we see often will be called for an unresponsive patient. In the umbrella of unresponsive, obviously medics, EMTs, law enforcement, that covers a lot of things. They could be in cardiac arrest. We have to factor in the situation. So one of the things that we use in our differential diagnosis, if I have a 22-year-old that is unresponsive in cardiac arrest, that's not a normal thing, right? When we see full arrest or near full arrest, if they're barely breathing, but not a palpable pulse, at that age, unless they're born with some sort of congenital defect, they've had injury or things like that, that's not something we expect. We expect that in the 60 plus age ranges, because we've had a lifetime to enjoy ourselves at Super Bowl parties and things like that, and eat fried foods. When they're young, and it's, again, a real eye-opener, I think, for everyone in public safety, the first time you go on a call for someone that is younger, the same age or younger than you are, and they're on the cusp of survival versus non-survival. And so in those cases, when it's someone young, our minds automatically have to switch over to what is the cause. And the most common cause for those young ages is drugs and or overdose. So that really does change how we have to respond and how we have to think about it.
Just a loss of interest in almost everything else. I see people that, when I put them in my car and I say, well, what do you like to do? And this is all I do. I drive to Chicago for heroin. I drive to Gary for heroin.
I do this, I do that for heroin. I shoplift to support that habit. All their hobbies have just gone out the window. Their relationships out the window, even animals, it's just all about the drugs. And it's real unfortunate. I see it with girls, like, they're 20 years old and now they're dating a 60-year-old, and he's got them hooked on narcotics, and it's just a shame, because that beautiful young lady would never, date someone that much older than her that, is just a jerk, and they've compromised so much, and it just doesn't have to be that way,
What I look for is a unhealthy looking subject. So if you look at myself, you might say I have a tan, I have a little bit of weight to me. A different type of subject who is using opioids might look as if they had been starving themselves for 15 to 30 days. Not proper hygiene, so looking for different types of sores all on their face. Teeth is a big thing. If you're looking at someone's teeth, this is America, it's 2019, you should have some decent looking chompers, but those type of people, the one thing that they only care about is using narcotics. They don't care about the simple things as taking a shower, eating healthy food. It's when can I get my high and how fast can I get it? And if I don't get it, now I'm going to go through withdrawal symptoms, and it's better for me just to get high than to go through withdrawal.
When I do presentations at functions, one of the things I try to tell parents is if you start to see your child making drastic changes to the way that they're dressing, when they're not keeping up on their hygiene like they used to, where they're not showering every day. Now, we're talking about teenagers here, so you have to take everything kind of with a grain of salt. But there's going to be some specific changes with the people that they're hanging out with. The grades are dropping. People that, they're going to be sleeping a lot more than normal. Things like that are kind of the red indicators that show that there's something going on with your child. Now, once again, we're talking about teenagers, so that could be something just being a teenager, but when we're starting to see people start to abuse prescription pills or anything that's an opioid, we do start to see those types of behaviors in kids. One of the things that I think is a real problem in today's society is, as parents, we want to have that bond with our children. We want to be their friend. And unfortunately, that's not your role as a parent. You are a parent, and there's no such thing as privacy when you're a teenager. You should be, if you're not keeping up with your kids' technology, they could be hiding all sorts of things in their cell phones. You need to be able to go through their cell phones. More than likely, the parent's the one that's going to be paying for that bill. So you have a perfect right to go in there. Now, I know a lot of people say, well, that's an invasion of my child's privacy. Once again, they don't have privacy when they're a teenager. You need to be that responsible adult. You need to take their phones whenever you want, and you need to be able to go through all those little secret apps where they can be talking to people about whatever. And you need to take appropriate action once you find something like that, because once something starts, it escalates so quickly, and you don't want to get behind the eight ball.